Okay, so if you, or maybe your partner, have ever gone online looking for ways to uh, improve erection quality,
Hmm.
you know what it's like. It's just this confusing, honestly, anxiety-ridden swamp out there.
Hmm.
Herbal teas, powders promising miracles, just spectacular claims everywhere. Welcome to the deep dive. Today we're going to try and cut through all that noise. We want to figure out what the research actually says works, and maybe more importantly, what's actually dangerous.
Yeah, and that anxiety you mentioned, it's often exploited, unfortunately. Our sources really highlight a critical safety issue here. Men are frequently buying these, well, herbal formulas online. These products promise almost, mythological results, but often they're secretly packed with actual prescription drugs. They're camouflaged. Specifically, compounds like sildenafil, which is the active ingredient in Viagra.
Right. And that leads us straight to this urgent, mandatory disclaimer from our sources, doesn't it? Because you just have no idea what dose you're getting in those things. Is it pure? Is it contaminated? And crucially, how does it interact with your specific health situation, your other meds?
Absolutely. That's paramount. So, look, before we even start talking about any solution, whether it's natural or pharmacological, the core requirement has to be stressed, okay? Never self-medicate. Don't use these products without talking to a professional first. That means your primary care physician, maybe an endocrinologist or urologist, they have to review your full clinical history. Because the potential for really severe side effects, especially drug interactions, it can literally be a matter of life and death.
Understood. Safety absolutely first. Okay, let's get into it then. Let's unpack this starting right at the foundation. We often think of erectile dysfunction, ED, as just a simple plumbing problem, right?
Yeah.
But the source materials we looked at, they are adamant. This is fundamentally a multifactorial issue.
Oh, it's far more complex than just blood flow, yeah.
Mm.
Sure, it relies on your general capacity for vasodilation, how well your blood vessels can open up throughout your body, but then you layer on top of that your metabolic health. Think systemic inflammation, hormonal balance, testosterone, thyroid, insulin resistance is a big one, and even the quality of your rest and sleep. Basically, if the body's kind of failing in other areas, the erection can be like the canary in the coal mine, signaling deeper issues.
Yeah, that makes sense. And I think maybe the most crucial insight the research points to is that emotional, that psychological link. One source even called it the aha
Yes.
moment.
It's fascinating, isn't it? How an acute psychological stressor, maybe, chronic stress from work, or you're just severely sleep deprived, can cause a temporary failure. Clinically, it's sometimes called a gattiazo. And this can happen even to men who've had, like, top sexual performance their whole lives.
Wow, so just one bad
Yeah.
experience.
One bad experience, exactly. And that single isolated physical failure can then trigger the real long-term problem. Suddenly, it's not really a physical issue anymore. It becomes psychological.
It creates a mental block.
Precisely. That one event can kickstart an actual anxiety disorder or literal stage fright about future performance. Think about a veteran concert pianist, right? They have one bad show, maybe they miss one crucial note, and bam, suddenly they're consumed by self-judgment every single time they sit down at the piano. It's the same kind of mechanism.
So that single physical blip literally rewires the brain to expect failure next time.
Yes. And that self-judgment, that fear, it generates adrenaline. And what does adrenaline do in a classic fight or flight situation? It causes vasoconstriction, it tightens blood vessels. Stage fright literally causes vasoconstriction in the penile tissue, shrinking it and inhibiting function. It's physiology responding to psychology. And this is exactly why so many men report, Doc, I have absolutely zero problems when I masturbate. Because when they're relaxed, enjoying it privately, they aren't burdened by that internal pressure to, quote, comply.
Okay, so if you're listening to this, the big message here is the solution is almost never just grabbing a pill. You have to address the underlying foundation first. The sources really stress fixing lifestyle factors, things like smoking, excessive alcohol, high triglycerides, chronic inflammation, all the usual suspects. But, and this is key, it also means maybe seeking counseling or therapy to deal with intimacy issues or just to overcome the psychological fallout from those past performance failures we talked about.
Exactly, that holistic approach. It's basically a non-negotiable first step before you even think about moving towards supplements or pharmacology.
Right. Okay, speaking of supplements then, let's look at the natural approach first, specifically for improving blood flow. If the goal is boosting vasodilation, what natural products actually target nitric oxide production?
Well, the main ones we see discussed, often widely used in sports actually, are arginine and citrulline malate. They're known as potent precursors to nitric oxide, or NO. NO is this powerful little molecule that relaxes blood vessels. So athletes use it for that muscle pump or congestion, which is basically hypersemia, vasodilation. But that same mechanism helps deliver blood, oxygen, nutrients to all peripheral tissues, and that, of course, includes the penile tissue.
Okay, that covers the circulation side. But hang on, the source mentions watermelon rind being rich in arginine. So why aren't we all just, like, downing gallons of watermelon juice? Is the concentration in a supplement that much different?
That's a really good question. And yeah, the traditional link, between watermelon rind and aphrodisiac qualities in ancient medicine, Ayurvedic, Chinese medicine, it's chemically sound because of the arginine. But the dose is the issue. To get a genuinely therapeutic dose of arginine just from food, you'd have to eat an absolutely massive, totally impractical amount of watermelon every single day.
Okay, not realistic.
Not at all. So the supplements basically ensure you get that consistent high-dose delivery. The research generally recommends consistent use of arginine or citrulline malate, they say, before workouts, but also, crucially, before sleep. The idea is it improves overall cardiovascular health long-term, which then indirectly helps with, early-stage ED.
Got it. So consistency and getting the right dose are key there. Now, what about the other side of the coin, the anxiety and stress we just discussed? If someone's under chronic high stress, high cortisol, are there natural solutions for that?
Yes, absolutely. That's where adaptogens come into play. These are compounds that are really useful for people dealing with high physical exhaustion, maybe emotional conflict, chronic lack of sleep. See, when you have chronically high adrenaline and cortisol levels, you get peripheral vasoconstriction pretty much everywhere. Your body thinks it's constantly running from a lion, right?
Yeah, survival mode.
Survival mode, which makes it basically physiologically impossible to be primed for sexual function. You're not built for intimacy when you're trying to survive.
Makes total sense. So what are some examples of these adaptogens?
Common ones include fenugreek, ginseng, ashwagandha, and rhodiola. These compounds essentially help the body become more resilient to that physical and emotional stress. They help prevent those hormonal or neurotransmitter imbalances that can really mess with both sexual drive and physical function. Now, while other natural actives exist, things like mucka, certain mushrooms for DHT, choline for acetylcholine, the research we reviewed observes that the most substantial, consistent improvements in practice, for early-stage ED anyway, are most commonly seen with that combination. Argin citrulline for blood flow, and adaptogens for stress resilience. Assuming, of course, those lifestyle changes are also happening.
Okay, let's pivot then. We've covered circulation stress. Let's talk hormones. Yeah. If circulation and stress are foundational, then testosterone is like the necessary support structure, right?
That's
What's
correct.
the impact of low T or hypogonadism?
Right. Low testosterone, or low T, has a kind of dual negative impact. It's really important to understand both aspects. First, it directly hits the sexual impulse itself, the libido. The receptors in your hypothalamus, they need testosterone. And here's a critical detail from the sources. Even something like sildenafil Viagra may not be effective if there's no T-driven excitement to begin with. If the fundamental desire isn't there because of low T, the physical mechanism just won't initiate properly.
Wow. So you could be perfectly capable physically, but if the brain isn't getting that T signal for desire, the pill won't just magically create it.
Exactly, that's the first tip. Second, T also directly influences nitric oxide release locally, and it affects the necessary venous tone in the penile cavernous tissue itself that's required for competent blood filling and maintaining the erection. So if T is low, the actual physical mechanism is compromised too. It's a double whammy. Less drive and less physical capability.
Okay, so if someone listening suspects low T might be a factor for them, what's the sort of clinical checklist they should maybe discuss with their doctor?
Well, you'd look for a cluster of clinical signs. Things like increased abdominal fat, persistent fatigue or low energy, maybe loss of muscle mass even if they're working out, sometimes mild depression or just lack of motivation. And crucially, of course, a noticeable loss of sexual impulse or just inertia, lack of interest. Now, if blood tests confirm that T is robustly low, it's also really important they check estrogen levels. These are often high in men with low T because body fat converts testosterone into estrogen. It's a process called aromatization.
And I remember the sources mentioning hair loss drugs.
Yes, absolutely crucial point. They need to check prolactin levels too, especially if the man is taking certain medications like 5-alpha reductase inhibitors, that's finasteride or dutasteride, commonly used for hair loss. High levels of these, typically more feminine hormones, estrogen and prolactin, actively inhibit testosterone's function, even if T levels look okay on paper. So if the clinical symptoms line up with the lab test confirming genuinely low T and checking these other hormones, then testosterone replacement therapy, TRT, might actually be necessary to restore function specifically in the sexual area.
All right, now we're moving into, let's call them the big guns. The pharmacological landscape, specifically the PDE5 inhibitors. These are the prescription drugs, right? Designed to boost nitric oxide release right down at the pelvic level, favoring blood flow. And they were initially developed for patients with cardiovascular risk, like hypertension, diabetes.
That's right. These molecules, starting with sildenafil back in 1998, really changed everything. They are highly effective, no doubt about it. But crucially, there are differences between them, and those differences often determine which one might be right for a particular person.
Okay, let's break them down. Start with the original, the famous one. Sildenafil or Viagra.
Okay, sildenafil. It's generally considered the highest potency drug in this class. It provides a very firm, durable erection and often allows for a quick recovery for a second encounter. However, it's relatively short-acting. Its effect kicks in maybe 30-40 minutes. Max duration is technically around 8 hours, but practically it's more like 5 to 6 hours of solid effect. But the downside, the con, and this is why the sources often caution against just jumping to it first, it has the highest side effect profile of the group.
Okay, tell us about these side effects. What are we talking about?
We're talking potentially severe nasal congestion, like really stuffy nose. Headaches can be quite common, stomach discomfort, and a very noticeable generalized flushing. One source literally warns your face turns red, your ears and nose become dark, and essentially, quote, you become a Smurf having sexual relations.
A Smurf? Seriously?
That's the description used. It's uncomfortable, obviously, but also just completely attention-grabbing, not exactly subtle.
Wow, your face turns red, ears and nose dark, become a Smurf. That sounds like maybe not ideal for a first date. Is that trade-off in potency really worth dealing with that level of discomfort for most people?
Well, for many men, the answer is no. And that's precisely why tadalafil, brand name Cialis, became so incredibly popular. It's often called the weekend pill. It's excellent for sustainability because it can last much, much longer in the blood, up to 48 hours in some cases. And importantly, the side effects are significantly milder than sildenafil for most users. Less flushing, less headache.
48 hours, that's incredible flexibility. What about using it regularly, like chronic use?
Yeah, that's actually one of its best applications, according to the research. Taking a low dose, say 5 milligrams daily, is often recommended for more long-term or chronic ED. Think about diabetics, for example, who might have some pre-existing arterial damage. Taking it nightly is thought to help recover arterial viability and elasticity over time. The goal there is to gradually restore natural morning erections. And a huge benefit psychologically is that it completely removes the anxiety of having to, plan sex around taking a pill an hour beforehand.
That makes a lot of sense. Are there newer options, maybe for guys just starting out, or those whose ED seems tied mainly to that acute stress or anxiety we talked about earlier?
Yes, there are. Vardenafil, which is Levitra, and Avanafil, which is Spedra, are the newest generation. Spedra in particular is known for its very quick onset. It can start working in just 15 to 20 minutes. We sometimes call this the youth pill, informally. It's often recommended for younger men, maybe in their early to mid-20s, or really anyone experiencing ED, primarily due to acute anxiety or stage fright. The reason is these newer ones tend to cause the least side effects overall. Less flushing, less congestion, and importantly, less interaction with food or moderate alcohol consumption compared to sildenafil.
Okay, lots of options there. But regardless of which specific prescription medication someone might consider with their doctor, we absolutely need to hit that critical safety warning one more time, right?
Cannot be overstated, absolutely. These drugs, sildenafil, tadalafil, vardenafil, avanafil, must never, under any circumstances, be taken by patients who are also using nitrates. Nitrates are medications often prescribed for angina pectoris, chest pain related to heart issues. Combining PDE5 inhibitors with nitrates can cause a severe, potentially fatal drop in blood pressure. It can lead to cardiac arrest or death. Professional medical supervision reviewing all your medications is absolutely mandatory before starting these.
Okay, that is a potentially life-saving warning. Got it. Finally, let's just quickly pivot to one more solution mentioned, something that isn't actually for ED, but can indirectly help fix it. Duloxetine or Prilogy.
Right. Duloxetine is interesting. It's actually a short-acting selective serotonin reuptake inhibitor, SSRI. It wasn't designed for ED at all. It was specifically developed to treat premature ejaculation, or PE. So why does treating PE indirectly help erection quality sometimes? Well, think about it. PE itself is often rooted in nervousness or that performance anxiety, that stage fright. It means the patient often can't achieve or maintain a full, firm erection before that neural threshold for ejaculation is met too quickly. In fact, just taking a vasodilator like Viagra might even worsen the PE situation by increasing excitement too rapidly for them.
Ah, so it sort of speeds up the climax too much for the physical erection part to fully catch up or last.
Exactly. Duloxetine works differently. It works on the nervous system to elevate that neural ejaculation threshold. Basically, it increases the time available before climax. This provides crucial security and control for the man. And that increased security, that confidence boost, it generates positive neurotransmitters, dopamine, oxytocin, endorphins. These positive signals then support natural vasodilation and a more competent sexual impulse. So it's a really remarkable kind of confidence-based indirect fix for erection quality in men suffering from PE.
Wow. This has been a really vital deep dive, hasn't it? We've
Mhm.
covered so much ground from the deep psychological roots of performance failure and the role of stress adaptogens, all the way through hormonal therapies like TRT and the detailed differences in the pharmacological landscape from the high-potency Smurf pill to the more sustainable weekend pill.
Mm,
It really drives home the point that your sexual health is just intrinsically tied to your overall physiological balance, metabolic, immune, neural systems, everything.
it really is. And if we just connect this back to the bigger picture for a moment, since we've seen that erectile dysfunction is so clearly multifactorial, right? Rooted in these systemic issues like inflammation, metabolism, circulation, it raises an important question for you, the listener, to maybe think about. If these underlying problems may be poor sleep, unmanaged stress, high triglycerides, insulin resistance are impacting such a specific sensitive function as sexual performance, what does that tell you about your general health? What other, maybe less obvious areas of your life, your daily energy levels, your mood, your focus, even your long-term cardiovascular future, might also benefit profoundly from addressing those fundamental factors of stress, rest, and metabolic health that we talked about today? Something to consider.